Ever thought about how your everyday habits could be affecting your kidneys? Today, we're diving into the importance of kidney health. These bean-shaped organs, tucked away in our lower back, have a crucial role to play in our overall well-being. They work around the clock, filtering nearly 150 quarts of blood every single day. That's the equivalent of a small swimming pool's worth of blood each year. They remove waste, toxins, and excess fluids from our bodies, while maintaining the delicate balance of electrolytes. These silent heroes also help regulate blood pressure, produce red blood cells, and keep our bones strong. But despite their monumental tasks, we often overlook their care. Just as we care for our heart, skin, and brain, our kidneys require attention too. After all, when our kidneys are happy, our bodies are happy. Remember, kidneys are vital to our overall health, but we often overlook their care. Unknowingly, certain daily habits might be harmful to your kidneys. Let's probe deeper into these practices, shall we? First up, smoking. A well-known offender, smoking damages more than just lungs. It's a significant risk to our kidneys. Smoking curtails blood flow to these integral organs and accelerates kidney function loss. Consider extinguishing that cigarette permanently for your kidneys' sake. Following closely is the excessive consumption of alcohol. An occasional drink isn't harmful, but overdoing it isn't advisable. High blood pressure resulting from copious drinking can lead to kidney disease. Hence, moderation is crucial with alcoholic drinks. Another harmful habit is the lack of physical activity. Exercise aids in managing blood pressure and cholesterol levels, promoting kidney health. Be it a spirited walk, a brief swim, or an intense gym workout, stay active. We also have the recurrent use of over-the-counter painkillers. Though they provide swift relief, their frequent and long-term use can lead to kidney damage or even failure. Usage should be as prescribed, and frequent usage should prompt a visit to a healthcare professional. A chat about R comes in next. A diet abundant in processed foods and sodium escalates blood pressure, taxing the kidneys. Hence, add more fresh fruits, vegetables, lean proteins, and whole grains to your meals. In essence, our everyday habits are paramount in preserving our kidney health. Being cognizant and modifying these habits can boost our kidney function and overall wellness. Being aware of these harmful habits is the first stride towards better kidney health. Let's embark on this journey together, shall we? Chronic kidney disease often goes unnoticed until it's severe. Do you know the signs? Just as a gardener knows the early signs of a plant in distress, we should be aware of the symptoms that our kidneys might be under duress. One of the most common signals of chronic kidney disease, or CKD, is fatigue. This isn't just the normal tiredness after a long day, it's a persistent exhaustion that doesn't seem to ease even after a full night's rest. This brings us to another symptom: difficulty sleeping. You might find yourself tossing and turning at night, struggling to find that sweet spot of sleep. This isn't just an inconvenience, it's a warning sign that your kidneys might be struggling, as they're unable to properly filter toxins from your blood, leading to restlessness. Decreased appetite is another red flag. Just as a car won't run without fuel, your body needs nourishment to function. If you're noticing a consistent lack of desire to eat, it could be your body's way of telling you that something's amiss. The buildup of toxins, as a result of decreased kidney function, can make food taste different and even cause bad breath. Muscle cramping, particularly in the legs, is another symptom to watch out for. These cramps are often a result of an imbalance in your blood, specifically a decrease in calcium and phosphorus levels due to impaired kidney function. It's like your body's way of sending out an SOS signal. Now, it's important to remember that these symptoms can also be indicators of other health issues. They're not exclusive to CKD. But if you're experiencing more than one of them, it's worth discussing with your healthcare provider. Early detection is key when it comes to managing CKD. It's like catching a small leak in your roof before it becomes a deluge. When you recognize these symptoms, you're not just spotting signs of a potential health issue, you're taking a proactive step towards safeguarding your well-being. Spotting these symptoms early can be a lifesaver. Many factors can lead to chronic kidney disease. Do you know what they are? Let's delve into some of the most common causes. Topping the list is diabetes. This condition is notorious for its ability to wreak havoc on our kidneys. How so, you may wonder? Well, high blood sugar, the hallmark of diabetes, can damage the millions of tiny filtering units within each kidney. Over time, this damage can lead to chronic kidney disease. Next in line is high blood pressure, another silent assailant of our kidneys. When your blood pressure is consistently high, it can put a lot of strain on the tiny blood vessels in your kidneys. This strain can cause these vessels to weaken or harden, preventing your kidneys from efficiently filtering waste and extra fluids from your body. Now let's not forget about inherited diseases, which can also pose a significant threat. Polycystic kidney disease, for instance, is a condition where clusters of cysts develop primarily within your kidneys. These cysts filled with fluid can enlarge the kidneys and interfere with their function. Certain autoimmune conditions like lupus can also lead to chronic kidney disease. These diseases cause the immune system to attack its own body tissues, including the kidneys, leading to inflammation and damage. Lastly, prolonged obstruction of the urinary tract from conditions like enlarged prostate, kidney stones, or some cancers can also cause kidney damage. It's important to remember that these conditions don't always lead to chronic kidney disease, but they increase the risk. And often, it's a slow and gradual process, with the damage building up over many years. But here's the good news. Many of these causes are preventable or manageable. Regular checkups, a balanced diet, and a healthy lifestyle can go a long way in safeguarding your kidneys. Understanding these causes helps us make better lifestyle choices for our kidneys. So let's keep our kidneys healthy, shall we? After all, they do so much for us, and it's time we return the favor. Chronic kidney disease can be managed and its progression slowed with the right treatment and lifestyle changes. It's not just about popping pills. It's about embracing a wholesome approach to your health. When it comes to treatment, medication often plays a crucial role. Depending on the stage of your disease, your doctor may prescribe drugs to control blood pressure, lower cholesterol levels, treat anemia, or alleviate swelling. They're not a silver bullet, but they can help keep symptoms in check and slow the disease's progression. But it's not just about medication. Dietary changes are equally pivotal. A kidney-friendly diet might mean reducing sodium, potassium, and phosphorus intake. It could involve cutting back on proteins or embracing a more plant-based diet. The specifics will always vary, but the goal remains the same: to lessen the workload on your kidneys and help manage your symptoms. In some cases, when the kidneys are significantly damaged, dialysis or transplantation may be necessary. Dialysis is a process that artificially performs the function of your kidneys, removing waste and excess water from your blood. A transplant, on the other hand, involves replacing the damaged kidney with a healthy one from a donor. These are more drastic measures, but sometimes they're the best course of action. Yet, prevention is always better than cure. Adopting a healthy lifestyle can go a long way in preventing chronic kidney disease. Regular exercise, maintaining a healthy weight, quitting smoking, limiting alcohol, and keeping conditions like diabetes and hypertension under control can all contribute to better kidney health. In the end, it's about making informed choices. It's about understanding that every bite you take, every sip you drink, every step you take has an impact on your kidneys. It's about realizing that your kidneys aren't just some abstract concept, but a vital part of you, tirelessly working to keep you healthy. Remember, your kidneys are vital. Treat them kindly. We've covered a lot about kidneys today, but the journey to better kidney health starts with you. We delved into the crucial role kidneys play in our bodies, filtering waste and maintaining balance. Next, we talked about habits that can harm these vital organs, like excessive alcohol consumption and smoking. We then moved on to the symptoms of chronic kidney disease, which can include fatigue, difficulty concentrating, or even changes in urination. Remember, early detection is key, so it's important to recognize these signs. We also explored the potential causes, such as diabetes and high blood pressure, and how they can be managed to prevent further damage. Lastly, we dove into the treatments, from medication to lifestyle changes, which can help slow the progression of the disease. Your kidneys thank you for watching. Take a step towards better kidney health today. Don't forget to subscribe for more health tips and advice.